Okay, now what do? Can you even put an implant in there? Well, not exactly. No. So there's always different things that come along. So there's a need for, more and more treatment that can become more expensive, obviously, than routine. It's not just a filling or one crown every few months or something, or a few months, years, hopefully. But it depends. So you don't know what the future is, depending on how healthy. Health is your wealth? Yes, it is.
All right, well, welcome to Emma Knows Money, and today's show is going to focus on health and wealth. One of my favorite topics is health. One of the things that I push people towards is making sure they take care of their health, because the healthier you are, the less it's going to cost you in retirement.
Health is your wealth.
Health is your wealth. And today we have Dr. John Anderson, who I met at the at Sunrise of Buckhead, I believe it was. We were there to speak about elder people and aging, and we hit it off. One, because we were there for the same reason, but two, we're also both ex-military.
That's right.
And Dr. Anderson is a retired United States Air Force vet, and so thank you for your service.
Thank you for yours as well.
You and and we won't talk about who really works in the military.
No,
who does not. We won't get into that today.
Probably not the Air Force.
No,
that's what I've heard.
That's what you. Yeah, and you're absolutely right. And you actually went to Emory University. You finished dental school at Emory, and then you did your residency at University of Texas.
Texas, correct.
Houston? Okay. Yeah. Well, I want to officially welcome you to the show.
Nice to be here.
And thank you. Part of the reason why you and I kind of struck up a very in-depth conversation had to do with my misinformation. I was told, or I had believed that dentures was something, and implants was something that was really expensive. And after having the conversation with you and realizing that I was really misinformed, I thought that this would be a good topic to touch on, because you'll end up talking to about 3 different generations. You're going to have information for the baby boomers, you're going to have information for the sandwich generation or the Generation Xers, and then also for the millennials, because inevitably they're going to be taking care of everyone as well. And it's better if we kind of have a good understanding from a financial standpoint of what this is going to cost us, right?
That's good.
So, Dr. Anderson, you are not a proctologist,
no, prosthodontist.
Prosthodontist. So what is a prosthodontist?
Well, we are focused on restorations, and of course the first thing you say is, well, so do general dentists, and that's true. Right. General dentists can do a lot of the things we do, then there's not a problem with that. However, we spend an extra time, in my case 3 years of residency, in which I focus at a much different level on patients who may be non-standard. What I mean by that is it's not beyond just a crown or just a denture, if you will, or something like that. We people that have oral cancer is something I happen to do. Implant restorations, and not a simple implant is a simple implant. Anybody can do it, but that is trained even moderately. However, there are cases that get really complicated, and that's what a prosthodontist does. So we do removable devices, we do fixed or cemented and implant retained devices. Those are called fixed because they're fixed in place, and you don't take them out at night or to clean them or so on. And then the other third aspect of it is maxillofacial. It's recognized by the American Dental Association as a true specialty. Okay. Even though, like I say, some of what we do, routine what we do, can easily be done by a general dentist, and should be, because there's only about 4,000 prosthodontists, give or take, in the country, okay. Of which I would say half are probably either institution teachers or military, and maybe included in that are a lot of their life members that are not really practicing full time, and then maybe a couple thousand of us that actually.
So
practice.
you're not dealing with kids at all.
No.
You're focused on the elder population. Is that?
Well, yeah, or younger. I mean, I do craniofacial development, like a cleft lip and palate situations, okay. Which we have to make them a little obturator so that they can even nurse day one. Okay. Things of that sort, that we do. But that can be, a lot of that's done by nursing staff these days. Okay. That we train, but they get a little more complicated after that. That's what I do, cancer, and that's what I do. Okay. Things like that.
So it seems, and again, this may just be my opinion, but it seems that as you get older, the issues that people have with their mouths or just dental issues just becomes a little bit worse. Is that?
That's true. I mean, you know, there's no way to say it isn't true in the
Okay.
sense that we're living longer now. And when we look back at the turn of the last, century, 50 some years old, give or take, with the men and the women being a little different, then you come to the beginning of this century, and it's 30 years longer than that. So time is a problem.
Okay.
I mean, because there's periodontal or gum disease, which just it gets worse with age. And the other problem we have too is medications, dry mouth. There's a plethora of drugs.
So that is real. The dry mouth.
Dry mouth is real, and what it does is causes the cavity-prone era, if you want to go for a good example, is under 20,
Okay.
and then but now really over 60, because all these blood pressure medications. Oh my gosh, the dry mouth, and a lot of antidepressants and things will dry the mouth. And that's a real problem if the saliva content goes down.
Okay.
In the sense that you get the plaque, which is the stuff in your mouth, the saliva, the water, and the sugar, and all that stuff that you're supposed to brush off every day. Well, even if you do, if you're very, very dry, everything sticks in a matter of minutes to an hour.
Okay.
So and this collects these little bacteria in these plaques. Basically secrete a kind of an acid byproduct, and they just start tearing up the teeth. And I just saw a patient this morning like that. I mean, just what are we going to do here? Well, because of the extreme dry mouth, we have 4 teeth left. One of them broke. We're going to go to a denture now because there's no sense in, because of the cavity, because of the dry mouth, and looking at the history of the patient, we have a problem.